This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're at the Aurora Medical Center in Oshkosh. We're going to be speaking with Dr. Gurjit Kaleka, and we're going to find out exactly what a vascular surgeon does. Well, thank you for taking some time with us today, and we're talking about your specialty. You're a vascular surgeon, so let's get into that. What does basically a vascular surgeon do?
Yeah, so my name is Gurjit Kaleka. I'm a board-certified vascular and endovascular surgeon. So vascular surgery is a very comprehensive approach to a lot of diseases, vascular diseases, including carotid disease, peripheral arterial disease, venous disease, dialysis access, and aortic aneurysms. We are the only specialty that are expertise and fully trained to deal with all the disease processes of vascular disease, including minimally invasive surgery, endovascular interventions, as well as open procedures, as well as medical management of each of the diseases.
So you're relatively new to Aurora, but your history, you've been in Wisconsin a long time. You left the state for a little bit, but family and you're a Wisconsin guy, aren't you?
Yeah, I was actually, my family migrated from India to Wisconsin in '92. So this is where I finished my high school in Racine, Wisconsin, and I did my undergrad in University of Wisconsin-Madison. And it's basically coming back home now to the family. So
now, vascular diseases, it's a pretty vast area. What are some of the diseases that somebody would be recommended for you? Because a person wouldn't necessarily contact you, they'd be referred to you for various illnesses.
Correct. So we, as a vascular surgeon, we provide comprehensive care for both minimal invasive as well as open surgeries. So we treat carotid disease, which is the main artery supplying blood to the brain. So we offer open carotid surgery, which is opening the neck up and removing the plaque and putting a patch on it, as well as minimal invasive carotid stenting in high-risk patients. In addition, we also do abdominal aortic aneurysm, which is a dilation of the aorta in the abdomen area. We treated that with endovascular minimal invasive approach by making a small groin incisions and putting a stent graft. As well as, if needed, we can also do open procedure, which means a long cut in the abdomen area and removing the aneurysm altogether and attaching a tube graft to it. We also do peripheral arterial disease. We do medical management as well as minimal invasive approach, including a groin puncture and fixing the peripheral arterial disease with ballooning, stenting, atherectomy, and even do an open surgical bypass if needed. We also manage varicose veins and spider veins. We typically start with the ultrasound and conservative management, including compression stockings. Then we also have minimal invasive approach, including ablation of the greater saphenous vein using radiofrequency ablation techniques, and also making small nicks and taking the veins out, as well as sclerotherapy, which is injecting the spider veins. We also treat kidney disease, including kidney stenting, as well as stenting of the mesenteric arteries. So patients who have abdominal angina, which is basically after eating food, if they get pain after eating, they may have blockage in the intestinal arteries. So we also treat that with stenting as well as open bypass surgery.
So doctor, if obviously a stroke is a pretty severe symptom, but outside of a stroke though, I would imagine yearly checkups, having your blood pressure, things like that can also identify potential problems?
Yeah, so carotid disease is a disease of people who have high blood pressure, smoking history, and diabetes, and as well as high cholesterol. So all these things need to be managed properly and keep under tight control to keep the disease from progressing. So this is where your primary care physician as well as your vascular surgeon comes into management of these pre-diagnostic risk factors.
I understand you also treat varicose veins and spider veins.
Yes, we also treat varicose veins and spider veins. It's fairly common problem, especially in women. So approximately 50% of the women above the age of 50 will have varicose veins. That can be related to either standing jobs, pregnancy, female gender, and also genetics and family predisposition.
All right, sounds very good. Thanks for taking some time with us today.
Thank you.
Now, if you have any questions about vascular disease, you can always check with your primary care provider during your annual exam. If you have more questions, you can always give us a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.